Hi friends, I am Dr. Sunita Gupta. I am a consultant gynecologist with Rosewalk Hospital and today I am here to talk about menopause. Menopause is cessation of periods. Menopause means menstruation is pausing, that periods have stopped. So if the periods stop for 1 year, we call it menopause. But before it stops for 1 year, it can become irregular. Patients can have scanty periods, delayed periods, periods coming after 2 months, 3 months, 6 months, or even heavy periods can be there. That is all called perimenopause. Perimenopause can also last for about 2 to 5 years. If you are aware of it, then you won't get so distressed about it. But definitely you should meet a gynecologist if your cycles are not regular. Menopause normally occurs at between 45 to 55 years of age, but the age of menopause runs in the family. Sometimes if your mother had menopause at 51 years of age, most probably you will also have menopause around that time. Some people, they have a very smooth time during menopause and they don't even come to know. But there are people who have a lot of distressing symptoms around menopause and they have to seek medical help. Being aware of the symptoms of menopause can also help a lot, and most of the time we don't need to treat these patients. Just reassurance and some mild lifestyle changes can help in relieving these symptoms. Patients may have a lot of anxiety, depression, ghabrahat. They may feel unnecessarily without any reason. They are feeling very suddenly they are not feeling well. They are not able to sleep. Insomnia is there the whole night. They are not able to sleep, and they don't know why it is happening, what is wrong with them. This is all part of menopause, can be a part of menopause. And because of lack of sleep, they may not wake up fresh in the morning, they may not be able to work properly. There have been patients who have told me that they want to leave work because they don't feel they can cope with the extra stress of work. But these symptoms, they normally subside on their own also within maximum 1 or 2 years. It can be treated. We can give you hormones. HRT can be given for 3 months, 6 months, and that can help in making the transition from a high hormone body to a low hormone body more smooth and less stressful for the patient. And then hot flashes are another distressing symptom, that the AC is on and you're feeling hot, your face is flushed, absolutely distressing symptoms which can be treated medically. Recurrent UTI, especially after intercourse, and dryness of the vagina is another common symptom of menopause, and which can be treated with some hormonal creams, and maybe antibiotic may be needed sometimes. There is lack of libido at this age. So most women, they accept the new norm and they don't want to take treatment for it, but there is treatment available. If you feel that you don't feel normal like that, then there is treatment for that also. Weight gain is another issue around menopause. Around 6 to 8 kg weight gain is acceptable during menopause. But if you are already obese and if you are already having some joint issues and diabetic, then these ailments can get aggravated by weight gain. Then maybe one should work not to gain weight, though one should accept one's body. You should not try to be like a teenager, that thin is in, so even after menopause I want to remain thin. There is no need to be so aggressive. You can do a little bit of dieting, like wiser food choices rather than dieting really, and regular exercise for half an hour daily, small frequent meals, and taking lots of high fiber diet, like more of fruits and salads, especially things like papaya, banana, and avocado, broccoli. These are good for menopausal women. And so diet changes and lot of water, 2 to 3 liters of water per day is a good idea for women. And increasing the intake of phytoestrogens, which are natural estrogens which are found in plants, can also make you feel fitter. Like soya bean has a lot of phytoestrogens, so you can take soya snacks, you can soya milk, and sometimes patients get lactose intolerance after 40 plus, and if they take milk they start feeling very gaseous and irritated and bloated. So then they can switch to almond milk or soya milk. That will help in. And of course, there are certain trigger factors for hot flashes, like alcohol intake can trigger hot flashes. So you can minimize the intake of alcohol. Smoking can cause problems. It can weaken your bones also, and it increases your incidence of cancer. So smoking should, passive or active, both kind can be harmful. So if you can avoid that, then caffeine like tea, coffee, aerated drinks, all these can also trigger hot flashes. Very salty food, very spicy food, fried food, they can be triggers. And hypoglycemia, like if you have a lot of gap between meals, then hypoglycemia can also trigger hot flashes and symptoms of stress and all that. So it's better you have small frequent meals. Another thing I want to talk about is Kegels exercise. Kegels exercise is very important. You tighten the potty hole and pull it upwards for 10 seconds and then relax. Then again tighten it, pull it upwards. Along with it, the vaginal opening and the urine opening. These are the 3 openings in the pelvic muscles. So all 3 will tighten and they will be better. So because a lot of women have urinary leakage after menopause, so this will keep the tone of the muscle, and all these symptoms may not happen. Uterine prolapse is common after menopause, that the uterus starts coming down. You have to get a surgery done, get hysterectomy done. So if you do these exercise, Kegels exercise 25 times in the morning, 25 in the evening regularly, then probably you can avoid these problems. Then regular health checkups are very important at this age, because 40 to 60 years is the age for getting cancers, gynae cancers. So every year ultrasound and pap smear can make, then we can detect it early, and early detection means we can cure it also. So that is very important. And there are other ways of managing menopause, acupressure, massages, they can also help. So I hope you found my tips useful, and I hope you will benefit from this talk.